It feels lonely to go through loss and infertility. And it feels, I felt like my body betrayed me at first. Just introduce myself. I'm Jacqui Jackson, and I have been a patient with Cherokee Women's and seeing Dr. Luttrell specifically for more than a decade. I would say maybe somewhere between 13 and 15 years. A significant amount of my life. But my husband and I run a child welfare ministry called Ignite Hope. And Dr. Luttrell was actually very instrumental in helping us recognize the need for this. When I first came to him, I found out that I have pretty severe endometriosis. Which was just a part of my story and really a part of my infertility journey. So, our oldest two kids came through the gift of adoption. Our youngest two kids came biologically as total surprises, and the care for my obstetrics was through Cherokee Women's, which was precious, and y'all took great care of me. And my husband and I are very appreciative because I was super high risk. And then we have two bonus kids through spiritual adoption that are older. So Dr. Luttrell and Cherokee Women's have played a significant part in that, just walking through adoptions and high risk pregnancies. And he literally prayed for God to bless us with children. So we went from just working so hard just to get our initial family, our core family, three of us, and God keeps bringing children in. And Cherokee Women's has been a part of that journey personally, and I guess professionally also. And the very first time that my husband Jeff and I sat down with Dr. Luttrell, he said it was really likely that at some point I would need to get a hysterectomy just based off me just orally telling him what I had been through up to that point. My previous doctors had just put me on unnecessary to me birth control pills to try to manage that. So I spent decades upon decades just taking the different types of birth control pill in an effort to manage all of the symptoms that came along with my cycle. I thought I probably had endometriosis, but Dr. Luttrell did it was like 6 different procedures: laparoscopy, hysteroscopy, DNC. Like, he did so many different things I couldn't even tell you. And in the midst of all this, we were in an adoption process and very much desiring to be parents to children. We had one little girl home, and we're waiting on more kids. And he had prayed for God to bless us with children, either through my womb or through somebody else's. And 6 weeks after he said that prayer, our son was born through adoption. And 10 months later, we found out we were expecting our youngest daughter biologically, which just sent all of us over the edge. And that was not an expected part. Even when I met my husband, I had told him, by the way, if you want biological children, that's not really possible with me. So, good luck. Good luck finding a fertile myrtle, and may you be blessed with children. And my husband wanted to adopt anyway. So we kind of thought all of our kids would come that way. So having Cherokee Women's be a part of being able to have children biologically was precious. I can't think of any practice or any doctor that I would have trusted to walk all of that out with, because like I said, I was super high risk and I had already had a number of losses. And after you go through miscarriages, just the heart stuff that you go through. And I mean, honestly, just the fear I felt being able and desiring to carry these babies to term. I really needed someone that was going to handle me with kid gloves, and y'all always have. Well, I mean, I tell you, I've been through the ringer. I've had 6 miscarriages and gone through adoption processes, and I literally feel like I have had to fight to bring in every piece of our family to bring us all home together. Almost like you're a woman, you were just made to do this. And people, it's easy to celebrate the tummies and the showers and all this stuff when it comes fairly easily. But when you've had a big journey, and if the baby quits kicking, you end up having to call in the middle of the night because you've already gone through so much trauma. Um, it's really good to have nurses that care, and a physician staff that is okay being woken up in the morning by a tearful mom who just can't handle any more loss. And it's also really amazing to have a provider who gets that God uses adoption as a beautiful part of his redemption story. So, I just think if you have a heart to be a mom, that's really a God calling on your life. It's a heavenly desire because there's not much about it that's easy. But it is so worth it. So whatever you have to go through to get your littles home, that's just going to be an awesome story to tell them one day, and an awesome, way to say how wanted they were and how much you went through. And, I wish every kid had that. So, but our organization is Ignite Hope, and you can find us at ignitehope.online, or on Facebook at I Hope for the number 4 orphans. And we're here for resources, wraparound support, coaching, because our family has literally walked through this every which way that you can. So that's what we do.